yes, there is a stigma, which I think is unfortunate because there shouldn't be. And even as I say that, I know myself, if I had to do a night shift and I was drowsy, your immediate thought would be, I could do it. I don't need to get an Uber. I don't need to ask a friend. But I think we need to keep beating that drum because it is no different than driving under the influence of alcohol. And we now understand that patients are dying because of medical error. 100,000 patients or more a year. And I would venture to bet that those numbers are probably higher.
Hey everyone, welcome to the Nursing Insights podcast. My name is Stephanie and I'm a registered nurse practicing in the state of New Jersey. Getting right to it, the state of healthcare right now is tough, to say the least. Let's just say that the nursing shortage does not spark joy. We can sit in that and stew in it for a while, but we can't live in it forever. Things are changing. So join me as your host as I partner with the New Jersey Collaborating Center for Nursing to hear from nurses across the state about their experiences, trials, and triumphs in the nursing profession.
Welcome back to the second part of our conversation with Dr. Carol Ash, where we talk about the impact of night shift work working against our circadian rhythms and drowsy driving. If you haven't heard the first part of our conversation yet, go tune in to the previous episode to catch up and also hear from Ashley Martino, a nurse who had a bad accident after falling asleep at the wheel while still adjusting to her night shift schedule. So we've been talking about how the culture within the healthcare system is very much geared toward this historical lens of I had to do it. I had to live through these difficult shifts. I've gone through the rigor. I remember in nursing school myself, when we would meet with nurses coming off of, or even in my early days clinically, I would hear from nurses who would talk so disparagingly about, they needed to nap. And it really comes with a stigma in so many ways because there is this perception of you need to be 1,000% all of the time, but we are only human. So I'd love to hear from you, Dr. Ash. Have you seen this culture within healthcare? And in what ways have you seen it impact individuals?
You went there. Historically, we have this image of people in healthcare and an expectation of those in healthcare that you have to push through normal physiologic barriers to remain at the patient's bedside, to be there to care for them, that there's honor in that, right? And those individuals who really care about their patients are the ones that are willing to push through, stay longer, do what is necessary to be by the side of that patient. And maybe at one point in time that might have been somewhat reasonable because the human physiology is the same now as it was back then. But what makes that even more dangerous, Stephanie? I mean, first of all, the mindset is all wrong. But what makes it even more dangerous is technology is advanced to the extent that there's a tremendous amount of expertise now necessary to really care for patients. We have an aging population, and the disease burden and the complexity of disease is even greater. So the demands on nurses, and if you think about, you go back, 40, 50 years ago, I could remember when I was the captain of the ship and all the nurse had to do was just follow the orders that I gave them. And they really didn't have to critically think, right? Those days are gone. I'm not the sole captain of the ship. It's about moving to teams, right? And we need every member of that workforce functioning at their peak. So unfortunately, the stigma is still there. It's amazing to me how those mindsets and the culture, how long it can take to shift the culture about what we need to be doing to keep a healthy and high-performing workforce. And we now understand that patients are dying because of medical error. 100,000 patients or more a year. And I would venture to bet that those numbers are probably higher, right? And we know people who are either not getting enough sleep, they're drowsy at work, or they're fatigued, are the ones that are going to be more likely to have patient errors. So yes, there still is a stigma, but I think we need to really press on past that and realize that like everything else, you have to have psychological safety and understand that this is not about our nurses. This is how we've designed our workforce and how we've designed the environment of care, and that there's things that we can do to redesign our systems, how we structure our schedules, how we work with our nursing workforce to make sure you have the right nurse in the right shift and give them the tools that they need to really perform at their peak. So yes, there is a stigma still, which I think is unfortunate because there shouldn't be. And even as I say that, I know myself, if I had to do a night shift and I was drowsy, your immediate thought would be, I could do it. I don't need to get an Uber. I don't need to ask a friend. But I think we need to keep beating that drum because it is no different than driving under the influence of alcohol. And I remember when I was a teenager, no one thought that that was a problem. Now, most people would absolutely think twice and would not hesitate to say, maybe I need to call an Uber or maybe I need to ask a friend. And we need to be able to get to that point with drowsy driving as well.
Yeah, that's just in line with what Ashley mentioned, which is her quote was, as nurses, we are working with patients and we need to have a keen sense of judgment. We need to be on top of our game when taking care of patients because that's where mistakes come in. And we know that nurses need to prioritize their sleep. I'm just curious if you have any thoughts on what could be done at an organizational level to help prioritize nurses' sleep.
Well, first and foremost, I think it's, having these conversations like this and having nurses like Ashley coming forward with such a dramatic story, which Stephanie, I think, is probably not that unique, right? I could tell you my own stories of driving home after doing a night shift or, not just the night shift, but working long hours. If you're working 12-hour shifts consecutively, you're going to have fatigue and you're going to start to see people drowsy driving because of insufficient sleep, not just the night shift. So it's a problem for everyone in healthcare. And so first it's just being mindful. And I think it would be really important for part of even the onboarding process of anyone coming into a healthcare organization to go through a program. Like there's programs online that go through all the physiology, all the known strategies for mitigating this, both on the side of the employer and the nurse or even anyone who's in the healthcare workforce. So I think we have lots of education about how we deliver best practice for the patient, and we don't consider understanding drowsiness and sleep needs as an important part and skills as being a healthcare provider. But I think it should be. So that would be number one, making sure we're all well educated about what needs to be done, because this is really at the crux of it. I don't think we're ever going to get to solving this till we change the culture about sleep. So education would be the start. And then understanding that everybody is different and you want to give each of your employees some control over their schedule, right? And understanding that there's some nurses like your friend who do well on the night shift, and some nurses like Ashley where it's a struggle. If you're bringing on board a new nurse, it's always a smart idea to make sure that nurse is never working alone on the night shift, right? So you have the buddy system. And if you're finding that you have a nurse that is demonstrating the things that are suggestive of the fact that they're getting drowsy, then what's the plan to help mitigate that for them right then and there? So do you have a strategy for, even while you're on the job, drowsiness mitigation? Do you have nap rooms? A nap that's maybe 15 to 20, no more than 30 minutes can go a long way to mitigating that drowsiness on the job, and even providing an opportunity for a nurse to nap before they get on the road and drive. And I could see a young nurse being on the job and not necessarily having colleagues or somebody. I mean, certainly they could call an Uber, but that could also get quite expensive, right? And so if you have a young nurse, do you have a program where if you're tired, just call me? So creating a network for nurses to tap into each other to help support each other when they're trying to drive home. And then understanding some of the science when we do the scheduling for nursing, not just looking at it, how many FTEs do I have and where can I plug them into my schedule, but really being thoughtful about looking at some of the literature and how you can structure nursing schedules so you minimize drowsiness and fatigue. So for instance, if you have a nurse and you have them working 8-hour shifts, the literature will tell you could work 5 days in a row, and then you want to have at least 2 days off before you go on the next cycle. And then for every hour that you increase those shifts, you want to minimize the days they actually work. So if you're working 8-hour shifts, it's 5 days. If you're working 10 hours, it's 4 days. If you're working 12-hour shifts, you really don't want your nurses working more than 3 of those shifts in a row, and then you want them to have several days off to recover. And then just reminding the nurses on the time when they're not working, those off days, being mindful of the fact that you want to get your sleep, arrange your social schedule as best you can, and before the shifts, taking those naps. So those are some things simple things that can be done to really minimize this immediately.
It's amazing that there are so many things that are actionable right now, truly, across all of our health systems that could really make a difference for our nurses and for our professionals across the industry. Really, we have nurses who are working night shifts, but we also have our respiratory therapists, our lab technicians. Again, this is a very widespread issue because everybody is on the road. Everybody is commuting. Everybody has their own ways in which they are taking care of patients that we need to be sharp and focused. So absolutely wonderful insights, Dr. Ash. So, Dr. Ash, are there nurses for whom these strategies may not be as effective for?
That's a great question, Stephanie. And yes, that there are nurses that would, despite all these strategies, still struggle with drowsy driving or fatigue on their shifts. And those are nurses that might have a sleep disorder, such as sleep apnea. We know there's individuals with insomnia, narcolepsy. So there's a whole host of sleep disorders that would really need to be identified before a nurse would benefit from these strategies. And so if you're really doing all you can do to make sure that you're prepared to be on a night shift and minimize drowsiness and fatigue, and your employer is doing their part as well, and you're still struggling, well, you may be one of those nurses that really will tolerate night shifts not as well. And there are some individuals that will struggle with it more than others, and that's okay. It's not a reflection on you're a nurse that's not as dedicated to the job. Or you might have a sleep disorder, and some sleep disorders can be quite serious. So if you're still struggling, that's when you would want to reach out to one of the sleep professionals who could take you through an assessment and determine, is there an underlying problem that needs to be addressed first, or even just help you with some of these strategies so that you can do better on the job.
And that makes sense too when we were talking before about sleep inertia. Are there folks who may be struggling with daytime sleepiness as well from some of the disorders that may not be affecting the night shift specifically, but we know that sleep has that impact as well?
Oh, exactly. And yes, even during the day shift, if you have an underlying sleep disorder, you can be present at the job, but not really fully engaged. And many people, unfortunately, we chalk up these symptoms to lots of other things. We don't realize sometimes how sleep deprived we really are. You'll say, well, it can affect your mood. You can be more irritable. You're less likely to be able to have a memory or recall of the things you're learning. And, we just kind of say, well, isn't everybody tired, right? Not that I'm struggling with anxiety and depression or irritability because I'm sleep deprived. It's because life is a challenge. And what you might not realize is, yes, life is a challenge, but it'll be incredibly challenging for that individual that is not able to get a good night's rest.
Phenomenal. Something that you were mentioning before are resources. And I know you and I had been discussing a little bit some of the articles that you had brought into the conversation. Would you have any resources that you'd want to share with listeners?
Yes, actually, I in an effort to really do a good job for all of you, I found this one article that I thought was really great. It's the Mitigating Drowsy Driving Risk for Night Shift Nurses. And it's just a viewpoint. It's in the American Journal of Nursing, and it's written by Janine Geiger Brown and Anthony McDonald. And it was published in October 2021. And I just thought it was a nice commentary to really emphasize how important this issue is. And to highlight even from Ashley's story, she spoke about her drive was 20 minutes. And in this article, they even note that driving, typically you won't see problems with drowsiness if you have 30-minute or less drive home. And Ashley is an example of it doesn't matter how short the drive, it's a problem. And they emphasize this in this article that while drowsy driving is an inevitable consequence of shift work, it's really unacceptable because what we're essentially doing is every single morning putting tens of thousands of nurses on the road who are impaired drivers, and that we're creating a significant risk for our nurses and the public. And so until we start realizing that we need healthy nurses, we need a healthy workforce, and we have a shortage of nurses. And it is well known that when you're a drowsy nurse, when we don't focus on creating a work environment and making sleep health a priority for our nurses, then we're not going to have safe patients. We're not going to have safety for our public. And it's well known that this is a work dissatisfier for our nursing staff and takes a hard-working nursing team and puts them in a situation where they'll struggle to do the job as well as they could. It increases turnover rate. And so we're faced with all these challenges that we are today. This is one thing we can do right now to improve the nursing profession and really would say to our nurses, we care about you and we care about your health, and we certainly don't ever want to see a nurse in Ashley's situation. I think it's just the time is now to say, let's start doing what we can to address this.
Yes, and I think it directly relates what you're saying to the word that we've been hearing a lot, especially around the pandemic in our nursing workforce, is burnout.
Correct.
How can somebody be ready to go to work the next day if they don't have the energy and if they're exhausted?
Correct.
Absolutely. So if we know burnout is on the mind, there's no way that sleep is not a factor.
Yeah. And this culture of, nurses are these thick-skinned angels. And, another article, as I was trying to put some things together for you, I thought it was just such a reminder of how we just kind of think nurses are superhuman and our healthcare providers are superhuman, and we're human too, right? And so it's really, really important that we focus on what nurses and our healthcare providers need for their health if we're going to not only have patient safety, but workforce safety.
Absolutely. I'm sure there is not a patient in the world who wants to hear that their nurse had 4 hours of sleep the night before. Nobody wants that. And the patients don't want that. The nurses don't want that. We don't want that as a society for our nurses.
Correct.
I'm curious to hear, what are some of the pieces of misinformation you see frequently circulated? You had mentioned that Ashley had brought up some very common pieces of misinformation. Do you feel like the same pieces are circulated regularly?
Oh, they definitely are. It's really interesting to me. So I've been in the field of sleep since the 1990s. And I remember when I first started in this, I would have thought by now there would have been a greater appreciation for, again, going 24 hours without sleep and the significance of that, because these things have been known for some time. But, we have this conflict between what we need to do to deliver healthcare and what's reasonable to expect our healthcare providers, and certainly nurses, to be able to do. So again, ongoing culture, it's just amazing how long it really takes to influence culture and the mindset, right? And that's what this really comes down to, changing the culture. And I think the concern is, well, how are we supposed to do this? How are we supposed to keep the care provided 24/7, right? And that it would be difficult to implement some of these mitigation strategies, that it would put a strain on the workforce, and that it would be cost prohibitive for us to go in this direction. And in fact, the reverse would be true. Because when we have nurses who are at work struggling to stay awake, when they're not able to perform the tasks as well, the critical thinking, their judgment is impaired, then we really have nurses that are present but not really fully engaged in the job. So the studies have all shown the exact opposite would occur, that if we focused on ensuring good, healthy habits and mitigation strategies to help night shift nurses and nurses who are on long shifts, we'd actually have a more productive, efficient workforce. And we could do more with less. So I think that that's the biggest myth, that this is not possible to do. And I think that's why we haven't paid much attention to it. And I think that, again, we could start with some simple strategies. And one thing that every single hospital and every health system has is sleep specialists. So if we were going to design a code team, we'd get the cardiologists, the ED doctors, maybe the intensivists, and those nurses that work with those physicians to come together and say, well, what's best practice? And let's come up with the policy and the protocols, and we get the job done. But when it comes to worrying about how we're going to address this, we're not getting the subject matter experts to weigh in. And there's nurses that have found some strategies that have worked for them. And I think we really owe it to each other to really go there and challenge each other to do this better.
I love that analogy of why wouldn't we bring in the specialists just as we do a code team? Why wouldn't we do that for our own nurses, for our own staff who have the need that needs to be met?
Correct.
So that makes perfect sense, and I hope to see that movement forward. Another lever that we could possibly pull, I'm just curious if you have any thoughts, is virtual nursing or any of the technology-assisted nursing that seems to be a very hot topic right now. Do you have any thoughts on how virtual nursing or technology-assisted nursing may be assisting in any way with the perils of sleep schedule and shift changes?
Definitely, if you think about it, you could do so much with virtual nursing, because you could say we have a nurse that's at the bedside, right? So if you're the nurse at the bedside in that time zone where the patient is, right, and you're working a night shift, wouldn't it be fantastic to be able to tap into a nursing workforce that was in a different time zone, that would not be dealing with the same difficulty with drowsiness? So even if you said, okay, we're going to have a workforce from California tap in for several hours at night to help offset the difficulty nurses might be having on a night shift. So, nationally, there really could be a way to make this work from a virtual nursing support team, right? And even if you said, well, I'm the bedside nurse, but with all the different monitors that we have with the remote capabilities, you could say to that bedside nurse, why don't you go take a 30-minute nap during your shift, and I'll monitor the patient. And I'll alert you if I need you to come to the bedside for any type of critical task. And the same thing would happen at the time of awakening from the nap, because you can have sleep inertia. If you've awakened from a nap, it can take some time for that grogginess to fade and for you to really be at full alertness. Well, virtual nurses could be helpful there as well. So I think, again, the technology is there, that we have the knowledge to know what to do, and it's the same problem everywhere in medicine. It's that implementation, right? It's getting the knowledge into the practice at the bedside, that translational medicine, and translating what we now know about workforce safety into real practice at the bedside.
That makes perfect sense. Another idea that I've heard that I thought was so interesting is having AI look at nursing shift schedules and understand it and analyzing what nurses may be at risk for compromised attentiveness just based off of the way that they're being scheduled to work. Because in some cases, you could look very straightforward and say, this person has no way they're getting enough rest, or this person maybe has a little bit of flexibility in their schedule and could, if they wanted to, take on more responsibilities.
Well, Stephanie, I think it's going to be a fascinating future, because what you're suggesting, look at what's happening with even, the personal monitoring, right? Physiologic monitoring. So you could even detect that a nurse might be more drowsy and not really capable of managing the workload for a shift based on their brainwaves, right? And you could look at, if you have an Apple Watch that's looking at sleep patterns, you would know before the nurse even arrived at for her shift that your schedule and your sleep has put you at high risk because you have insufficient sleep to really manage that upcoming night shift. So I think going forward, there'll be a lot of opportunities. And you can even, no different than we monitor patients, because we have ways of saying, before the patients even have symptoms, there's those indicators that the patient is getting into trouble, right? And we have people now who will reach out to a patient at home and get them into a program to prevent that acute episode. Well, we could do the same thing with nurses at some point. If you're working the night shift, we'd be able to reach out and say, hey, I noticed you didn't get much sleep last night. You have an upcoming shift in a couple of days, and get a coach to maybe give them some tips on how they could prepare themselves for that upcoming schedule. So I think AI has implications for mitigating drowsiness in ways we probably have not yet considered.
We really in some ways live in the future. I was, even as you were speaking, thinking about how, what if it's just that some of our health systems invest in self-driving cars and chauffeur their nurses home? Like, why not?
Yeah.
There are so many ways that we can use technology to help really reduce the risks that are associated with drowsy driving.
I think the biggest thing is we really do have the knowledge, and we have the tools, and we have the resources to get this done and improve the work environment for nurses and mitigate these problems, so we never have another Ashley. It's really, as you sit and you listen to this, it's one of those moments where, thank God for the airbags, because based on the description of the story, it could have been a life-ending event. And you realize here's this young nurse in the beginning of her career, like full of life, and what a tragedy that would have been. So I think even from a state perspective, it would be nice to see the state nursing associations really challenging all of us in healthcare to come together and figure out, how do we not leave it to each and every nurse to solve this themselves? And no different than we have HRO programs, and we have a framework, and we have tools, and we say, nursing staffing ratios and all kinds of things that we understand. We really need to standardize how we function as a profession. I think we can start coming together and tapping into those subject matter experts, asking all of us across the state to work together to do this better.
Thank you so much for sharing your insights, Dr. Ash. Truly priceless. Thank you for your work out there, fighting the good fight to make sure our nurses get their rest. We appreciate you so much, and thank you for joining us on the podcast today.
My pleasure, Stephanie.
Thanks for listening, everyone. We'll see you next time on the Nursing Insights podcast.
This podcast is brought to you by the New Jersey Collaborating Center for Nursing and the Rutgers School of Communication and Information.
the mindset is all wrong. And we need every member of that workforce functioning at their peak.